Heard there, tomorrow Finance Minister Enock Godongwana will deliver his maiden medium-term budget speech. This usually comes with competing interests. The Healthy Living Alliance, HEALA, says National Treasury's failure to hike and expand the scope of the sugar tax risks lives, and that the hike could net the fiscus about 2 billion rand in the short term. In 2018, South Africa introduced the 11% health promotion levy on sugary drinks to curb the country's astronomical consumption, which is fueling diseases such as diabetes and high blood pressure. Nzama Mbalati is the program's manager at HEALA. He joins us now via Zoom. A very good morning to you. There was such divided opinion when the health promotion levy was first introduced. Why do you think the finance minister, or this finance minister, will heed your call to have the levy increased by 20%?
Good morning, Desiree and the viewers. We believe we are actually bringing along innovative ideas and solutions to the fiscals. In one hand, in the other hand, we believe that we are bringing actually the stop, closing the tap of the non-communicable diseases as a result of bad diet. So we believe now is the time for government to relook at the health taxes from tobacco to alcohol and the health promotion levy.
It's not the first time you make this call that you say is aligned to the World Health Organization standards. What makes you think Minister Godongwana will listen?
We believe that if you look at the COVID context and the number of morbidity and mortality as a result of people with underlying conditions such as diabetes, such as hypertension, heart diseases, these diseases have actually amplified. COVID has amplified the need for urgent response in the scourge against in fighting non-communicable diseases in South Africa. And we believe the dire strain of the fiscals to fund essentials, social protection, the basic income grant, and other social interventions such as grants, COVID-19 relief grant, there is a need to raise an extra 2 billion rands if the health promotion levy or the sugar tax was to be increased to 20%.
Oh, that should be good news to his ears. But you're also calling for the expansion of the levy to include. You're also calling for the expansion of the levy to include ultra-processed foods, saying these risk the lives of many South Africans. Which specific foods are you referring to?
So the ultra-processed food, we're talking about food that were plant-based or animal-based. This food goes through a long industrial processing to a point where you cannot recognize that this was a plant-based kind of food. So these foods, they are put preservatives in the form of excess sugar, salt, and fat to preserve them to stay longer. To make them cheaper and have a long lifespan. So it's things like cornflakes, it's things like your added sugar yogurts. So it's some of the food that we actually take on the staple food that have a long shelf lifeline, and these foods actually do not have a lot of nutritional value besides excessive sugar, excessive salt in their package. So these are the foods that we believe if we can define what's healthy food in South Africa through the process of the Department of Health. That department has embarked of the front of pack warning labels. We can be able to actually get much more revenue that we can subsidize healthy food and healthy snacks for people for convenience, and in that way actually making much more needed revenue and protecting people from the harms of the ultra processed food.
Now, your ultimate goal, as you say, is to get South Africans to make healthier choices. How is industry responding to these possible changes that could adversely affect their profits?
So one of the incentives of the health promotion levy, and if it was to be expanded and to be implemented stronger, is a reformulation. So you might have seen from the big sugary drinks producers that you now get a lot of no sugar, less sugar, cold drinks, for example. And this is as a result of the health promotion levy. And again, the health promotion levy has demonstrated that since it was implemented in 2018, there were studies done in South Africa across Soweto and Langa that have shown 50 and 60% reduction in the cold drink consumption for the people who we call or we term high consumers of the sugary drinks.
So just remind us about the work of HEALA and where the proceeds of the Healthy Promotion Levy go.
So we are advocating as Healthy Living Alliances HEALA for equitable access to healthy and affordable food for all in South Africa. We are implementing a nutrition literacy across provinces of Limpopo and Eastern Cape, and we're hoping to expand as part of educating and raising awareness to people on, the importance of healthy eating and the importance of healthy food. But over and above that, we are hoping that with the coalition that we're building with progressive civil society organization, we'll be able to hold government accountable, to hold industry accountable in creating an enabling environment for people to access healthy food and fixing the broken health system that is actually not enabling us through regulations to actually access healthier food.
Well, thank you for talking to us. We hope your efforts get some level of engagement from National Treasury as we look forward, of course, to that maiden medium-term budget speech by Finance Minister Enock Godongwana.